Good day everyone, I am YLLAISHJA Aranas and our group will be tackling about Republic Act number 9173 or also known as the Philippine Nursing Act of 2002. So to start off, let's discuss what Republic Act number 9173 is. Republic Act number 9173 or also known as the Philippine Nursing Act of 2002 provides for a more responsive and comprehensive regulation of the practice of nursing in the Philippines. It outlines the scope of nursing practice, standards of education, licensure examinations, and ethical guidelines for nurses. The law emphasizes the role of nurses not only in curative care, but also in preventive, promotive, and rehabilitative health services across various settings. It also strengthens nursing education, ensures continuing professional development, and upholds the welfare and rights of nurses to enable them to deliver safe, quality, and globally competitive care. Let's now discuss the sections in RA 9173 that are relevant to nursing informatics. First is Section 28, which is the scope of nursing practice. It includes the use of health information systems and technology in planning, implementing, and evaluating nursing care. Second is Section 29, the Nursing Education Program. It encourages integration of informatics, research, and evidence-based practice in the curriculum to prepare nurses for modern healthcare demands. Third one is the Section 31, the qualifications of the faculty. Nursing educators must be updated in their fields, which includes familiarity with nursing informatics to teach emerging healthcare technologies. Fourth is the Section 26, the Standards of Nursing Practice. This mandates safe and quality care, which now involves competency in documentation, electronic health records, and data management. Lastly is Section 41, Incentives and Benefits. This highlights the importance of continuous professional development, where training in informatics supports career growth and adaptation to digital healthcare. For the first topic, let's discuss nursing practice in RA 9173 and accommodating the use of technology and information systems. So, how does the definition of nursing practice in RA 9173 accommodate the use of technology and information systems? The Republic Act number 9173, also known as the Philippine Nursing Act of 2002, outlines a broad and evolving definition of nursing practice that implicitly supports the integration of modern tools, including technology and information systems. While the law was enacted in 2002, before the full rise of digital healthcare, it provides enough flexibility to accommodate technological advancements. For instance, Section 28 defines nursing practice as encompassing activities related to nursing care of individuals, families, and communities in any health setting. This open-ended language allows nurses to deliver care not only at the bedside but also through telehealth, electronic health records, and other digital platforms. In modern practice, this means nurses are expected to engage with tools like patient monitoring systems, mobile health apps, and electronic documentation platforms as part of their day-to-day responsibilities. Furthermore, RA 9173 emphasizes roles in health education, research, and leadership, domains where technology and information systems are essential. For example, in research, nurses now use data analytics software and electronic databases to gather and analyze patient outcomes, improving evidence based practice. Similarly, in health education, nurses utilize e learning platforms and digital resources to conduct training and community outreach. For the second part, let's discuss RA 9173's comprehensive scope of practice and commitment to professional development in compelling nurses to acquire skills in nursing informatics. Let us now proceed to the next part of our discussion. RA 9173 mandates a comprehensive scope of nursing practice and a commitment to professional development. So the question is, how does this requirement compel nurses to acquire skills in nursing informatics? RA 9173's emphasis on a broad dynamic scope of nursing practice and lifelong learning naturally compels nurses to adopt new competencies, including those in nursing informatics. As healthcare becomes more digitized, the ability to interact with information systems is no longer optional but a core part of providing safe, efficient, and high quality care. The law's mandate for continued professional development ensures that nurses remain competent in emerging trends and technologies. For example, nurses are now required to document patient care electronically, use health information systems, and participate in telehealth initiatives. Without informatics skills, a nurse may struggle to function effectively within modern healthcare systems, potentially compromising both patient safety and their own professional standing. Moreover, the commitment to professional growth means that nurses are expected to pursue further education and training in relevant fields, including health informatics. Institutions like the Department of Health or DOH and various nursing organizations in the Philippines have begun offering training programs and workshops on electronic healthcare management, data privacy, and digital literacy. These efforts are directly aligned with RA 9173's goal of maintaining nursing competence in evolving healthcare environments.
Under Republic Act Number 9173, the Professional Regulatory Board of Nursing is mandated to monitor and enforce quality standards of nursing practice, which includes regulating the use of technology in nursing. The board ensures that nurses use tools such as electronic health records, telehealth, and other digital systems in a safe, ethical, and competent manner. It sets standards and guidelines, integrates nursing informatics into education and licensure exams, and requires continuing professional development to keep nurses updated with technological advances. The PRC-BON also upholds ethical accountability by investigating misuse of technology, such as breaches of patient confidentiality and imposing disciplinary action when necessary. While other agencies regulate devices and data privacy, the BON safeguards that nurses comply with these policies, ensuring technology enhances patient care without compromising safety or ethics.
For the RA 9173 provision for humane working condition and better career prospects, indicate support the adoption of nursing informatics. So for the RA 9173 or the Philippine Nursing Act of 2002 focused on giving nurses humane working conditions and better career prospects. This means fair pay, reasonable workloads, and opportunities for growth when nurses feel supported and valued. They are less likely to experience burnout and are more motivated in their work. Um, this supportive environment also makes them more open to adapting new technologies such as nursing informatics. Informatics helps streamline documentation, improve patient care, and enhance overall workflow efficiency. In addition, RA 9173 promotes continuous learning and specialization as healthcare become more technology-driven nurses with informatics skills and increasingly in demand. The law encourages training programs, certification, and academic pathway that strengthen this field. Overall, RA 9173 not only uplift the nursing profession but also build a workforce that is technological um, ready to meet the modern demand of the healthcare.
Hello, I am ALIAH Micaroz, and today I will be discussing the relevant laws related to the Republic Act 9173. So, the practice of nursing in the Philippines is guided by this very law, the Republic Act 9173, or the Philippine Nursing Act of 2002, which defines the scope, standards, and responsibilities of the nursing profession. However, this law does not stand alone as it intersects with other laws such as the Data Privacy Act of 2012,